Rapid reduction of maternal mortality in Uganda. RISE program's contribution to this success story. According to the 2022 report from the Uganda Demographic and Health Survey, in some reproductive health indicators, teenage pregnancy rates are still staggering at 24%, one of the highest in Sub-Saharan Africa. This means that roughly 1 in every 4 teenage girls between 13 and 19 has either had a live birth or is pregnant with their first child. The staggering numbers of teenage pregnancies not only increase the risk of HIV spread, but also contribute 20% to infant deaths and 28% to maternal deaths. Challenges like teenage pregnancy can be attributed to the limited access to sexual reproductive health information and the limited capacity of health workers and facilities to provide adolescent-friendly services and information about the changes in their bodies. The country has made significant efforts to reduce maternal mortality rates from 336 in 2016 to 189 per 100,000 live births in 2022. The RISE program has contributed to this achievement since its targeted implementation in 2018 to date, resulting in a reduction in maternal deaths. RISE, a program aimed at reducing high maternal mortality rates and improving sexual reproductive health outcomes, started in 2018 and is set to run until the end of 2023. The program is being supported by the UK government and implemented by Marie Stopes as the lead consortium partner.
Family planning is our biggest area of intervention. We have a countrywide footprint where we are intervening both through the private sector and the public sector. In the private sector, we have a network of clinics, pharmacies and franchises who we empower with skills to deliver high-quality family planning services. With the support of the government of the United Kingdom, we have been running a voucher to enable young people to access services through the private sector. Most of our work is in the public sector, where we intervene through health system strengthening primarily. We have trained more than 700 health workers to deliver high quality services, and this cascades into them training fellow health workers and those cascading it down to others.
The UK government is focused on empowering women and girls here in Uganda. We focus on both girls' education, female economic empowerment and giving jobs to women, as well as helping Uganda to tackle gender-based violence and supporting women to have a choice about their family planning. The challenge is clear. Teenage pregnancy is shockingly high in Uganda. There are high levels of gender-based violence, and maternal death is far too high. The challenges are huge, but what we've seen this week is that MSI are making a difference. They're working with health centres, they're working with local communities and changing attitudes and behaviours towards women's sexual and reproductive health. So it's been great to see that progress. The work continues, and the UK will continue to be a partner of Marie Stopes International.
This is one of those programs I've managed that have been very adaptive. We went through COVID-19, the pandemic, and still were able to continue delivering services. To date, the RISE program alone has provided over 2.5 million family planning services. Countrywide, it has been reaching and delivering services in 86 districts across the country. That includes the whole West Nile area, Karamoja region, the Eastern and East Central region, Central 1 and Central 2, that's your North and South Uganda, and in the Southwestern region.
The objective of the program is to improve people's agency and health through the provision of quality reproductive health services and information. This is done by improving healthcare capacity, skilling through competency-based mentorship of health workers, and removing barriers to access to family planning through last-mile service delivery and provision of accurate information to all. The program targeted all people, ensuring equity by reaching hard-to-reach areas, people living in poverty, and those living with disabilities. The RISE program has changed the lives of men and women in Uganda for the better. Through Marie Stopes Uganda's interventions, over 2 million clients have had access to contraception and over 4 million contraception services have been provided.
I want first to acknowledge the benefits which came along with it. Key among them definitely is the issues of development of health workers' capacities, both the peer-to-peer learning but also the aspect of mentorship to be able to develop that capacity. So we are looking at that. This is already a self-sustaining activity because those who have been trained will actually be able to train all the other staffs.
Access to reproductive health information can be a game changer in people's lives. Over 2.7 million people were reached, with social and behavioral change messages enabling people to make informed decisions. It is estimated that over 970,000 unintended pregnancies were prevented, which reduced the number of women who get pushed into poverty or face morbidity and early death due to unintended pregnancy consequences. 2,800 maternal deaths were averted, improving families' livelihoods and health because mothers were present. Through the on-job mentorship program, over 760 health workers were trained under RISE to provide quality contraceptive services. This has resulted in an increase in the use of contraceptives in public health facilities, especially for long-acting reversible methods.
We used to wait for Marie Stopes to come here and offer the family planning services, but now with that capacity building and mentorship, we can now offer all services for our mothers every time, every hour they need it. We used to have regular stockouts of family planning methods, but with the support of Marie Stopes and of this program, we have good stocks, we have adequate stocks. We were taken through the training for quantifying our orders. We now make proper orders for our drugs.
Marie Stopes has been conducting community dialogues, has assisted actually in building capacity of our midwives, especially as far as provision of the family planning methods is concerned, that is refresher trainings, reproductive health commodities ordering, and as well provision of these reproductive health services.
Marie Stopes has over 1,500 health workers at 700 public health facilities trained to provide quality contraception services, data quality improvement, and supply chain management. This has greatly improved service uptake in government facilities and reduced commodity stockouts.
Marie Stopes has actually been supporting us in the provision of reproductive health commodities in the Center 3s, the Center 4, and the General Hospital.
The RISE program is being implemented in 86 districts from 7 regions in Uganda. The goal is to reach everyone with not only accurate information, but a contraceptive of their choice when they want it.
Marie Stopes is renowned for service delivery, and we have piloted and delivered significant impact on our bespoke health system strengthening work, where we've mentored over 1,500 health workers, public health workers in health facilities to deliver long-acting reversible contraceptive services as part of their everyday work. This has made a shift from where a lot of partners come and deliver services at these facilities, but now building the capacity, hands-on skills to be able to deliver these services. And we have seen of 343 facilities where we've provided this mentorship, 200 of these facilities so far have been graduated to mean we've built enough capacity, and health workers are now routinely offering the full range of family planning services without requiring for Marie Stopes to visit. And when they have the skills and competence to deliver this, we've been able to pull out and go to other facilities to build this capacity.
We have built the capacity for better planning for SRH and FP at a district level. And here we have covered a total of 49 districts. And we sampled this in only 3 districts of the 15 that we did. And what this has shown us is that when family planning is better articulated for and planned in health facility plans and budgets, there is better itemization, and as such, there is more resource allocation.
The 5-year RISE program is winding down and will be closing in 2023. A lot has been achieved and many lives have been improved.
So as the RISE program comes to an end, we'd like to thank you for the enormous support you've given to us and all of our partners over the last 5 years to bring services to communities like this. This has enabled us to provide contraceptive services to communities just like this one over the last 5 years, and the support is incredibly important. Without this, these communities would simply not get these kind of services. So we're tremendously grateful for you for that, and we look forward to the future to continue this program activity for communities and others just like this.